it gives me great pleasure to welcome Margaret Foster.
Thank you.
Hold on, I just want to give you a
Okay.
little intro here.
Oh, sure. Go ahead.
Okay. So Margaret is the Evidence Synthesis and Scholarly Communication Librarian and the head of the Center for Systematic Reviews and Research Synthesis at the Medical Sciences Library, Texas A&M University. So she is the co-author of the first book written on systematic reviews for librarians, Assembling the Pieces of a Systematic Review, a guide for librarians. And recently, piecing together systematic reviews and other evidence synthesis that was published in 2022. She received the Presidential Impact Award from Texas A&M University in 2018 and the Lucretia W. McClure Excellence in Education Award in 2024 from the Medical Library Association. So again, Margaret, I want to thank you for being our guest speaker for this series. So now I'm going to turn everything over to you. So take it away.
I apologize. I didn't realize I was muted. So thank you for joining me this afternoon. Today we're going to start with part 4 of the systematic review process, which I quickly name paper. And so let's get into our objectives there. So today I want to go over some additional searches to the database searching, which we talked about last time, especially talking about when and how to update searches and when you might think about modifying them. And then we'll spend a lot of time talking about standards for reporting searches and the potential parts in the paper that you might offer input for the team. So I thought I would start with a different kind of way of looking at the phases of the review to kind of demonstrate why I divide them into these 4 main phases, and starting with the proposal. And that was our first session where we talked about what is the scope of the review. And I'm using these little squares here to kind of indicate how much of the available evidence that you might go through for each stage. So in the beginning, I suggest that teams just look at a little bit. We're trying to test out the feasibility of their eligibility criteria. We're playing with the searches and things like that. As you're getting into the protocol, you probably need a little bit more to work with. You need enough to pilot all the methods and figure out, is this going to work? When you get into the production phase, which is what we talked about last week, this is where they might have some percentage of that they want to do for a conference proceeding or something like that. Maybe they need to present some findings to funders, but this is where you're going to start to see some trends. And then finally, in this stage, this is where we really need to wrap everything up, right? So they can send off that paper, which is probably the main output that they were looking for. And so just like all the other phases, this one is divided into the different pieces, processes, starting with the plan, and then getting into the identify. And so this is where we're trying to wrap up all those searches. You could have been doing the Graylet searches in the production phase. I just kind of put them over here because we ran out of time of talking into any specifics last time. But any additional search techniques, some of those you need to wait until they've screened most everything. So I'm going to talk about those. Most of us don't really have a lot within the evaluate, extract, combine phase. That's where the groups are working on processing everything. And then lastly, we'll wrap up today talking about all things around reporting. So what are the different things we might play in the planning? So depending on your level of involvement, you might have some part in the writing. A lot of times groups will ask me if they hadn't already figured out a journal, help in selecting a journal, and then you might be negotiating authorship. So on this first part of it, you might if they're asking you to participate in some process of the writing, there's a few questions you might want to get answered, such as what is their timeline? Is this going to be a Google Doc? Kind of where is that going to live? How might they be dividing up writing? And it's probably that you just have a few sections that you might be looking at. And then are they using any kind of citation software? So that you'll know how you might best help them with that or make sure that you have your things added to it. In selecting a journal, this is where, of course, there's lots of ways of thinking about a nice list for them. They might seek recommendations from their colleagues about it. They could look at the journals that they included, articles that they already have. There's the Jane tool, which is a journal author name estimator. Now, this is limited to PubMed journals, so if it's a social science one, they might want to try a different journal selection tool. And lots of the publishers also have them. I try to stay away from the publisher ones just to give my group the widest range of options, but those are just a few things you can think of. And of course, we also want to think of all the things around. Is this a quality journal? Could this be a predatory journal? Things like that. So on this slide, what I tried to do was really think about, okay, this is for a systematic review. So what are some unique things that I think about when selecting a journal for that? So of course, I would want the scope and the audience of it to match the review topic, but they don't necessarily have to have been publishing reviews. I think for the most part, it's been that the scope needs to match really well. I've had really good luck in having clients that submitted to journals where it matched their scope, but they hadn't necessarily published a systematic review before. Now, of course, sometimes that means they don't understand some parts of the systematic review, such as why do you have so many tables and things like that. But we've had pretty good luck with that. So I always suggest that the team go and look at reviews that have been published in the journal if they have. Think about what are their guidelines around reviews? Are they following Prisma or some other tool? And because systematic reviews do come with so many tables, it's good to find out, okay, how many tables can I have? Where will supplements go and things like that? Because of course, a lot of times we know the search gets pushed to being in the supplement. And then, of course, there's open access. We want to think about that and support them when we can. So there's that. And then I get a lot of questions around authorship and systematic reviews. So I thought we'd go through a few slides on that and talk about this negotiation. So, of course, a lot of people do point to this criteria from the International Committee of Medical Journal Editors, and they have these 4 criteria that an author is supposed to meet. And so we see that first one says substantial contributions to the concept or design of the work, or acquisition, analysis, or interpretation of the data. And sometimes I've heard kind of thinking about the expertise that we bring as being searchers. I've kind of heard that be compared with, like a statistician coming in on a review. So that statistician may not be an expert on the clinical topic, but they're an expert on the biostat side of it. And so that's, I think, where you kind of see the separation out. Then we see these other 3 criteria, and we see all of those are anded in, where it talks about drafting the work, final approval, an agreement to be accountable. And sometimes that gives people kind of pause around being an author. So let's go into a little bit more detail here. So when I look at criteria 1, I see a lot of the usual kind of roles that librarians may play. So even in that first part, thinking about those substantial contributions to the concept, a lot of times when I'm meeting with teams, I am helping in that framing of the question, in thinking about, okay, what review type should this be? What's our eligibility criteria? And all of that is part of that higher level concept in designing the review itself. But if I don't do that part, I can still meet it with the searching and retrieving of the citations and management of that. And so it could be both, or it could be either of those where you can meet that criteria one. One thing that I really like about the criteria is the statement here that I have in quotation marks. And it's basically saying that if somebody meets criteria one, then denying them the opportunity to meet the other three criteria, you shouldn't say, oh, you can't be an author if you didn't give them that opportunity to do that. And so that's an important part of the standard if you're thinking about authorship and who's playing what role. The other thing on this page is that it does talk about non-author contributors and how that should work. And then there's a little part in there about AI usage and authorship. So you might go check that out. And of course, I put that on the link in the handouts. And so some best practices, some things I've tried to do over the years. I found that it works easiest in the negotiation if you have written policies that you can point to and show people. Sometimes going into these meetings can be a little bit nerve-wracking depending on the shift in power there. And so having that kind of straightforward, this is our service, this is how we treat authorship, makes it a little easier to discuss in that initial meeting. And I suggest sometimes revisiting that as needed as things change. One issue that I've had come up sometimes is the order of authorship. And I've seen people use kind of different systems for figuring that out. Sometimes this does differ by the discipline that they're in. And I've also seen a point system. So one of the things that I put on the handout, there's actually this, I think it's called Calcul Author, like calculator, but with author in it. And it's a way of like considering a point system, and whoever has the highest points is like first author, something like that. So I think there's different tools out there. I usually have had good conversations around this, but of course it doesn't always work out like we hope it does. So things to think about in your written policies. You might list out tasks that the librarian might do for the author criteria. You might list and kind of show users of your service, okay, if I was contributor, these are the things I do, and if I'm author, these are things I would additionally do, something like that. One thing we've also had come up in our service is questions around will librarians cover part of the OA fees as an author? And so I think each institution has to think about what makes sense for them. How things are right now for me, we don't have support for doing that. So I have to say that I could not contribute to that. But there have been other times when I did have funding and was able to contribute to that. So it's just one of those things that you might want to think about and may come up. So I thought we could do a poll now. So I have two questions. And so if we can get those up to ask you about your experiences. So which of the strategies have you tried? Okay, so this is great. So about 25% of y'all said that you had a written policy. A lot of y'all feel comfortable talking about it in the initial meeting or talking to it about the team. I have to go and look at chat and see who has additional ways of doing it. Oh, the credit one, that's a good one. Sorry, I forgot to mention that on here. So credit is kind of another system of thinking about authorship and making sure everybody is acknowledged for their contributions. Okay, so why don't we move on to the next question? Do I need to click share results? Okay, maybe I messed up. And so here's another question. I call it, have you ever? Um, oh, wow. Wow, this is really amazing. To see the variety of your experiences in here and how much it matches with things that have happened to me as well. Um, so I see that many of you have been listed as an author or contributor. That's great. And I understand sometimes wanting not to be listed as an author, and sometimes you find out later that something was published and you were not attributed correctly. Something that I've been trying to do kind of on an annual basis is going into Dimensions database where I can put myself to see if I've been acknowledged. And I think I added like 10 to 15 things to my resume last year because I went and checked for that. So it's something to think about if you are in a busy service, you might do that on an annual basis. And it really made me think about upping my the amount of negotiation I did around authorship. So thank you for sharing that. Let me check the chat and see. There's This is always where I learn so much from teaching these webinars. Y'all have given me some great feedback here. Yeah, so let me share these results. I didn't realize that wasn't happening right away, so sorry about that. Um, so here you can see that a high number of you have been either author or contributor. There have been times when you have not wanted to be an author. Um, you read about your attribution and you tried to search it out and find out what's happening. So some of the cases where uh, I just politely told them, that's okay, I don't need to be an author on here. There have been times when the group did not want to conduct a risk of bias appraisal of the studies and they were doing a meta-analysis and I did not feel that that was right. And there's just been other times where they cut corners or did other things. And I said, that's okay. I've been your librarian on this. You can acknowledge me, but I'm done with this project. And so I think it's really good for everybody to set their own boundaries and to have that conversation up front. So let's see if there's anything else in the chat and then we'll move on to the next part of this. I do have 50 slides, so I want to make sure. Oh, thank you, Megan, for answering the Dimensions question. I think that our library does have a subscription, but I have heard that there's a free one. So I don't know. Oh, and you don't see the results. I'm sorry about that. Okay. I think I've kind of summed up the results. So hopefully you got the gist of that. Let's move on to the next part. So here in the identify stage, this is where we're trying to wrap up all the searches. And there's, like I said, there's some techniques where they need to have screened everything from the main databases for you to really do those additional techniques. And we'll talk about when and how to modify. So just a little bit on the why. Why are we doing this? So publication bias is one of the big reasons why we try and search outside of just the main databases. And the definition here, I put this in quotation marks here, is when the results of the published studies are systematically different from unpublished. And so I kind of made up my own little diagram here showing where significant results get published and the other results, so the intervention didn't work, or it was the null hypothesis, right? Like it didn't, was it harmful or beneficial? Those other results kind of go in the trash can. And so there's been some studies trying to ask people, okay, why didn't you try to get something published? And sometimes it's because, of course, they could have been rejected, or they felt like, oh, this is unimportant, nobody wants to read this, or they, because they think, oh, nobody wants to read this, they don't give it enough time. So this is why this is what we see when we think about the different publication biases. There's different things that can happen along the way. So maybe it doesn't get published in a journal that's indexed in Medline. Maybe it's in a different, database, a smaller database, something like that. Maybe it doesn't get published in English. Maybe there's a big delay between when they did it and when it finally gets published. They decide, oh, I don't have anything else going on, let me finish up with this one. Maybe it's like a brief article instead of being full, and it's harder to sometimes find those. So here we see like the different issues that make him up. So then when we see them meet core standards for this initial searching, it's, for one, to get around that publication bias, but for two, it's also for trying to find those things that maybe haven't been finished, right? So we see those conference papers, the trial registers, and things like that. And so I did use this on the last time that we met. I showed this very similar, this table. And so we're going to kind of go through these and talk about thinking about it. But if your review, if it's not would not have a clinical trial, then you don't necessarily have to go and search the trial registers. So not everything in here has to be done for every review. It's just if it makes sense. I think every review should at least do the searching reference list though. Okay. So what are the different types of gray lit that you might think about? And for me, the gray literature search is definitely really important to work with your team. They're going to be more expert on your topic. And sometimes it's just a matter of asking them very poignant questions like important conferences for their topic. Maybe there's a government organization or something like that around it. And then, of course, if there are some trial registers that might be specific to their topic. And so I tried to put some links onto the handouts to several of the things that I have listed here. And this is just to give you an idea. And of course, not every review do you need to do this, just when it makes sense for you. Of course, some databases do already have gray literature in them. And so that's going to get you to some of that. And then these would be like additional options to that. So if you're already searching Embase and CINAHL, you may have gotten to some of the conference papers there. But the only way to make sure have you got all the conference papers would be to do a specific conference one. So I thought I would highlight a few of types of searching so that you could come back to this later if you are searching the study registers. So clinicaltrials.gov and the WHO registries, those are the two ones that are mentioned specifically by the Cochrane standards. Although a lot of what's already in clinicaltrials.gov is in the WHO ones, it is suggested that you search both. They do work a little bit differently, and so I put some of those differences here. so that you could see those. And then I also gave you an article that you might point to for some more pointers when you're going to search that. Then for searching the web, there's issues that can come up with that, right? So there's lots of reasons why you might search the web. And so you might be looking for, even if you went to like the government, to a government site to look for things, you still might miss things, or you're looking for other conferences or white papers, things like that. So there's lots of reasons why you still might search the web, even if you search some of those other places. But it is a big wide search, and so you need some ways of bringing those numbers down. And so there's different techniques that have been talked about and different tools that are out there. So one issue is that your reproducibility is going to be pretty low with most web searches. And so there's suggestions that, search in the incognito mode, or where it's not considering where you are geographically, maybe other types of search engines, and I put a few tools in here that you might think about. Then there's ways of limiting down those searches, maybe to like just PDFs. In this case, I added a little line there that I use when I don't want to see anything that's from PubMed in my search, and so I put that minus there in PubMed. So there's different ways that you might get at that. And then when to stop going through those results. I've heard different scenarios. There's one where maybe you set a limit. We're just going to go through the first 100 or 200 results. I've also heard the popcorn method. So let's say, you're looking at your list of results and you get to a page where there's nothing relevant on the page. And maybe you've only gone through the first, 100 or so, and you're not seeing anything else relevant. Maybe you stop, just like with popcorn in the microwave. You might stop after you don't hear any more pops after, I think it's like 3 seconds or something. So those are some different ways of trying to get a handle on just searching the web. So some other strategies that you might think about is contacting or advertising for studies, manual searching, citing, and errata searching. So let's talk about those. So in contacting authors or organizations, another way of thinking about this is advertising. You could talk with your group and see, what are the important groups? Are there any listservs that you're on where they could advertise that they're looking for studies that match a certain criteria, and see what comes of that. I worked on one review where we had done all of our database searching, and we had collected, I think, around 40 reviews. And then we did this step, and we found 14 reviews. It was an umbrella review where we would have not seen them otherwise, because in looking at their records in the databases, they never mentioned that they were a review in their abstract or title. It was really amazing that we found so many by doing this. Your group may also think about emailing known authors in that area and seeing what they have and things like that. So of course, like I said, in not every review would you do this, but in some reviews it may be very beneficial, and you could talk with your team about that. So manual searching, this has kind of gone in some ways out of style. I remember Cochrane used to have, I think it was a more than 20-hour hand searching course that you could take and certify in. Sometimes I've heard this called browsing and like I said, hand searching. But this is a part where you really have to understand and know that area, that specific area that is the topic of your review. So sometimes I've reached out to librarians that I knew had done a lot of work in that area and asked them, here's my topic, here's my list of resources. Is there anything special that I need to be aware of? And so is there's like an important resource that's known to be an issue, it's not well indexed, whatever that is, then it may need to be browsed. So something to think about. And like I said, this is another one where it's not every review would you need to do this. This is the one type that I suggest that everybody, every review should do. And so this is once you have those included articles, and it's also suggested that you do this for the related reviews. Maybe you go and look in a database like Web of Science, Scopus for those and see who did they cite and who cited them. And then there's lots of options that you have for how you're going to deal with these. I've had some group where they just want to grab all of those and they'll go ahead and screen them. Or maybe they want to do a little bit of screening before they're even moved into, say, Covidence or Rayon and decide what they want or feel like they should go through. I've done option C a few times. So option C is where I did go and collected all of the citing and cited references. But then it was like 5,000 articles. So then what we did was we developed a very simple search string to try and only bring back those things that matched the most important keywords that we had. With any of these, I don't necessarily do like an option B. It wouldn't necessarily be me that does sorting. This is usually something that I would train somebody on the team or multiple people on the team to do. But it is important to talk about how do they want to handle this, and how do they want to make sure that they're counting the things that they've sorted. So some another step to kind of think about and talk with your team. This last one is something that I came across when I was looking back through the standards. And I know I've heard other and seen in other webinars and things talking about, oh, you need to go back and see if it's if there's any retractions for your studies. I hadn't thought a lot about comments or errata, however. And so this is part of the Cochrane standard, and I think this could be a good time once you have that included list to go back and see, oh, has anything come out about it at a later time. It could be that you're using a search filter for like study type or something like that, and that may kind of knock out some of that errata or comment types of reports when you first pull down the search. So this is something to think about that would kind of cover and make sure you haven't missed that. When to update or modify. So some groups, they want to set up alerts, which is fine if, you know, if they're going to handle those if they're going to grab those RASs and then add them to their whatever source they're sorting with. I haven't found a lot of groups that are up to doing that. Usually what happens is they kind of have these set times, like every couple of months they'll come and say, hey, can you rerun the main database searches, things like that. So when you're updating the search, I've seen some journals where they want it within 6 months of publication. So I have a lot of groups that will be like, okay, we started writing. Now let's go ahead and get that search updated and see anything else we need to look at. Sometimes I've seen where people don't run all the databases or all the resources that they ran from the beginning. Maybe they just do, like, I'm putting this in quotation marks, the main databases of the search. And then, of course, we know that when you're limiting by date, different databases have different levels where you can do that. I'm using here the way that we limit down Medline and Embase to the dates. And then we know some databases just do by month and date, and some you can only do by year. And of course, that just means, you know, you can still update and then you're going to get some duplicates back, but at least it's something. And so I did put some details in here if you want to use either of the Medline or the Embase limiters that we have here and of what those fields are. But it's just to make sure that we're getting anything that's happened within that time period. Okay. And then when thinking about modifying the search, I tried to put those steps in here, the thought process I go through when thinking about it. So we've just talked about the gray letter search, these additional strategies, they're sorting these. And so this is where I want to think about, okay, did you find anything in doing that? And if you did find some new studies, are they indexed in any of the databases that we've already searched? And if so, why didn't we see them in that case? And then how could I modify the search? So sometimes you didn't see the article because it didn't have any of the synonyms that you used for something. And then there's an additional synonym. So maybe that only brings up like 50 more or something. Maybe it's a rare synonym. It could be that the abstract was so vague that to get that one article in would grab thousands of articles that are not relevant. So this is why I say it's kind of all relative and whether or not you're going to modify the search. But it's just something to think about when you see those new things come through. Does it make sense to then modify the search? And sometimes it does and sometimes it doesn't make sense. So I thought here we could take a few minutes and have you try out one of these resources. So these are very different resources in what they do. So Carrot2 is a way of searching the web. And one thing that I like about it is the different options you have for looking at the results. It does try and limit down the results to PDFs. And you can, whatever search you put in, you can have it go through the web or you can have it go through PubMed. And so it's just a different way of looking at the search results, and I found that to be really useful, especially I use this a lot in the beginning of a search to try and figure out what are some other synonyms, kind of what's out there. And then I also use it sometimes for my gray literature searching because, like I said, it does limit down to the PDFs. And then Jane is a very different tool, and this one is really for trying to figure out, okay, what journal would best match my my topic. You can put a title, you can put in a whole abstract. And so I just gave you a little list of different activities that you might think about doing in either of these. So why don't we take a few minutes to do this and we'll meet back here at 1:45 to give you about 5 minutes or so. And while you're doing that, I'm going to go through the chat and through the Q&A and see what else we need to talk about. So go ahead and try them out.
Hey, Margaret, we had a question in Padlet, and I'm going to go ahead and add that to the Q&A, just so you're
Okay.
aware. Just
Okay.
so I'll
Thank
put it to you so you can see it.
Okay. Thank you for that.
You're welcome.
So it's 1:45 now. So if you're still trying out these things, you can go ahead and keep doing that if you would like. I'm going to be working through the Q&A here and trying to answer the questions I saw there. So thank you for all your great questions. And then we'll have a little discussion about these tools and see what you thought. So one question was asking about cited references, uh, searching, sorting, and is that reported separately in Prisma? So when we get down into the next section and we talk about the Prisma flow chart, you will see that there is a different section for putting that type of searching. So those are reported separately from the database searches, and but there's still a lot of variations in how people do that. And there is a call for people to report on the different ways that they're thinking about doing that. And so I think it's good that they're asking for more transparency, and it gives us a little bit more space to put that information in. There was another question about Google Scholar and reproducibility. I'm sorry I didn't mention Google Scholar. I don't really search that for my reviews. I tend to rely on searching Google because I found it to be more open, lots more things in there than whatever the filter is where Google decides it's scholarly. But of course, you would you could still have some issues with reproducibility. But the article that I had cited there, I think, was talking about web searching in general. So I'm not sure if they covered Google Scholar specifically. There was a question about if I'm searching Scopus in the journal or the article that I'm trying to find the references is not in Scopus, then what would I do? So then I might turn to Google Scholar. I actually don't have Scopus. We only have Web of Science. So it hasn't happened too often. Most of the time, the article we're seeking is in Web of Science, but if not, then I would try Google Scholar, things like that. And of course, that makes it a little bit more tricky because you can't always get like the RAS file from each one. But yeah, that is something that's going to happen from time to time. There was a question about Carrot 2 and whether or not it brings back NCBI or PubMed links, and it does. In either case, if you click on the PubMed results or the web results, you'll still see PubMed results mixed in there. So I was trying to show you Carrot 2 is like a different way of looking at results, but usually I do some kind of Google search where I try and not out the PubMed just so I can see around it. As far as searching for the errata, usually the errata will be attached to that citation of the included study. And so you might, I would just search for those included studies within like Medline, Embase, wherever it was indexed, and then see does any errata comments, things like that, and also check for it in Retraction Watch. I'm not expert on this. I've just started delving into this and figuring this out, but I did want to mention it here as I hadn't really seen it or talked about it much. I'm sure other people have, and maybe I just haven't been aware, but that's how I might approach the search for that. Let's see, did I answer everything? There was another question about key articles, which I thought was really good. And in this, they were saying, you know, a lot of times when people come to us, we say, hey, show us 5 or 6 articles that you've already decided that you want to include. And then when we look at them, we're like, oh, these aren't really key articles. And they're asking like, what kind of weight should they put onto those? And so this is a conversation that I have with my the team that I'm working with. I will look at that list and I will think about their eligibility criteria, and I'll say, okay, do these really match your eligibility criteria? Because I'm about to use these to ensure this the search. So I just have a conversation with them about, are these really going to be included? But, you know, if they put like a review or something else in there, I'm like, well, you're not going to include a review, right? So I just kind of, and it also helps me to ensure that I understand their eligibility criteria as well. So that is an important conversation to have because you don't want to be struggling with an article that doesn't really match their criteria. Now, sometimes they have an article that's listed on there that does match the criteria. However, when you look at the abstract, it's missing one of the criteria. And the only reason why they knew that they would include it is because they read the full text. And so I'm not going to try and make a search that brings that one up and potentially those 1,000 articles like we just talked about in the modifying the search. But I want to be aware of that article. I want to check it out, you know, in another database if it's indexed there. So that's kind of how I treat the key articles. So I hope that answers that question well. And then I had kind of a long one more question here in the Q&A. Give me just a second to look at it. Okay, so best practice with groups, they're unwilling to maybe do the best practices themselves for their research question or study methods. Yeah, it's tricky, right? Because we are in the service profession, and we do want to like give our client our best foot forward. I just talk with them through it. A lot of times groups like this, if they have some flaws, they probably aren't going to want to work with you too much because you're going to be, pointing out things here or there. But I just give them my professional opinion. And of course, I stay as neutral as I can on it and just explain what I'm seeing. Um, so but I have had teams like this. So sometimes I just give them the results and they go off. Sometimes they publish, sometimes they don't. Um, but I usually, they don't want to interact with me too much after that, even though I try to be as polite and professional as I can. So you are in a tricky situation with that when it's not the best that it could be. Okay. So let's see. So what did y'all think about Carrot 2? Did anybody try that out? What do you think about the different way that it gave you results? I see somebody, they didn't get results when doing web results, but they got some for PubMed for the same search. That's interesting. I haven't had that before. I usually am not trying to do like a super advanced search in Carrot. I'm just usually, I still might do a few synonyms in there, but usually not a lot. Anybody else have a comment? What did you think about Carrot 2? Or did everybody try Jane? Oh, um, well, I don't know why you didn't get any results. Um, that's strange. Some of you liked it. Um, I don't know if Carrot 2 does AI. That'll be interesting. I need to look into that. So like I said, I kind of use this more in the beginning when I'm trying to figure out terms. Um, and I like the way that it kind of groups things together for you. I find this most useful on a topic where I'm not finding a lot. So I wouldn't necessarily use this for topics where there's tons out there. Um, so I see a lot of people really liking Jane. I found that it's easy for me to send clients to. It's quickly understood, and then they can play. And it also gives you a chance to talk about journal impact factors and other things if you want to. So, okay, great. So let's move on here. Okay, so like I said, with this third step, you might not have a lot of interaction with the team on doing this part of the pieces process. And then lastly, we're going to talk about the last steps of the process, which are explain, summarize, and share. In that explain part, what I mean by that is kind of what you would see in the discussion area. And we're going to get to that when we're talking about the limitation section of the paper. This is where you're kind of putting things into context. And for the librarian's role, you might be saying any limitations you felt the review might have due to the search. So this is kind of your chance to say that. So we'll get into that. So we're going to go through each section that you might contribute to and talk about what the standards are. And then I pulled together some examples. I will say for my examples, I was not trying to find great examples or terrible examples. I was just trying to find examples that we could talk through. And I did try and find things that were a little bit that were not terrible. I will say that. I was trying to find ones that would have at least some information, but we know that sometimes there's very little reported when it should be. So this is not all of the Prisma abstract list. This is a brief list. I think it may have closer to 15 or maybe 12 things on the list. I can't remember. But our part in usually the abstract comes in line 4 here. And so basically it says in the abstract, you should specify the information sources used and the date that each was last searched. So I think for the most part, we try and get them around the same date so that it's easier to report, but of course that doesn't always happen. So let's look at some examples here. I just did 3 quick examples, and these within the abstract, these were all the sentences around the information sources. So give me a second to look at those. And you could just put in the letters. Which ones of these do you feel like meets that very brief requirement? And I'll look in the chat to see what you think. So a lot of you are saying only B kind of meets that requirement. They didn't give a complete date, but at least they gave a month and a year. Although it's not exactly clear as to, is that when they ran the search, I think. C is missing the date. And with A, you might have the same question is, was that just what they limited to, things like that. But this is a good kind of cross-section of things that you might see when you're looking at abstracts. A lot of times they want to make the list briefer of the databases that they're listing. Or they don't always have room to put in the platform of each database. And I think that's okay because hopefully it's going to be listed in the methods section. But I think the date is really important to put in here because that lets the reader know, like, when was that last run and what's the recency of this article. Okay, so that was pretty straightforward. So let's get into some more here. So then when you get into the search narrative, we have a couple of different standards to look at. Of course, Prisma 2020, the list of things that a systematic review should report on, it has 2 items listed around the search. And then there's another search standard, the Prisma search list that lists 16 items. In the handout, I listed 2 articles in there around Prisma S. So one is the explanation document, and so that will go through all 16 items. And the other is kind of a brief article, and it's all around common questions on tracking records and the flow diagram for Prisma S in 2020. And I thought that was a really useful article, so you might find that as well. So what does Prisma 2020 ask us to do? So it has 2 main sections in there. First is the information sources. So we kind of already saw this in the abstract, only this goes a little bit further and it says not just the databases and the registers, but tell us the websites, organizations, what around the reference list did you do, things like that. It wants to specify the date for each one. that it was last searched. And then will see a lot more detail in the Prisma search list. And then for the search strategy, it wants to see the full search strategies for all of those things, including filters and limits. And I think sometimes when we read database searches, that when you look at the numbers, it's clear that they had some kind of filter because they wouldn't have got such a small number if they didn't have some kind of filter on. So it's really important to report any filters, limits, other things like that that are used. Now, when we look at the Prisma search standards, like I said, it has 16 items, and so we see this longer list here. And a lot of this is just kind of listing out some specifics about those the different things that we saw in the information sources request from Prisma 2020. It does mention multi-database searching, and I know the creator or the organizer of Prisma S, I think she's a bit of both, Melissa Reffelson. She had said that she knew people shouldn't really be doing multiple database searching for their reviews, but she wanted to get this in. So in case they did do this, we need to know exactly what they did. So in her case, you always want to remember that Prisma are reporting standards. So it's about what you need to report. It's not what you need to do. So when we're looking at, okay, what do we need to do? That's when we need to look towards the Cochrane standards, the Meeker standards. And then so we see study registries, citation searches, and here under citation searches, this is where you start getting a little bit more details, right? Describe any methods used for locating them. How did you do this? Did you browse the list? Did you set up alerts? Things like that. Talking about the contacts, so we talked a little bit about that. So you would say like, who did you contact? Things like that. So and you might not exactly say all the authors that you contacted, but you might say, oh, we contacted this many authors, or which authors did you like authors of the included studies, something like that. And then your additional methods. And then when we look at the next page of this is getting into the search strategies themselves. Of course, we want those to be copy pasted, the search filters. If you used any other searches to develop yours, it's really important. We like to be cited, right? We talked about that with authorship. And then was it peer reviewed? Things like that. And then the last part is getting into managing the records. So talking about what duplication process was done, things like that. And I know this is a lot of information I'm going through here. I'm trying to highlight these things and of course give you the tools so that you can look back on these. I do also want to highlight a little bit about the search that you would see in the Prisma 2020 elaboration document, which I've also cited here. So the elaboration documents are basically the articles that Prisma puts out that goes through each of their items and gives a lot more detail. And so you see that for Prisma 2020 for items 6 and 7 that are around the search report. I highlighted these ones because I felt like I didn't necessarily see these fully covered in the Prisma search. And the other thing to remember is that Prisma search came out right before Prisma 2020 was launched. And so while they do work together, there is a little bit of difference in them in some of the details. So one thing here, Prisma S says, oh, tell us, did you do peer review? And then Prisma 2020 is like, okay, well, if you did do that, then what tool was used, things like that. Is one of the options listed here. If you used a tool to translate the search strings. So last time we met, we talked about the polyglot from the Systematic Review Accelerator site. So that would be a case if you use that, you would want to report that. And then the last one on here is talking about, perhaps labeling the structure within your search as to which part is the population, which part is this or that. And so I feel like this gives us a lot of details that we can use when writing up our reports. um, and something to look back on. So hopefully that you find helpful. So here in our last bit together, I thought and we still have a few more parts of the search to go through, but I pulled up 3 examples, and here I have the 16 items required by Prisma. And I thought we might kind of go through here and see things that we think that they did well, things they may not did well. And we can even use some of the standards we've learned from MECOR to look at their search as well and see how did they do. So give yourself a few minutes, kind of look over this example, and we'll start working through the items and see how they're doing. Okay, so hopefully you've had a chance to kind of look through this a little bit. So let's do some easy things, and then we'll get into more complicated. Um, so let's look at the database and the platform. How did they do on that? Yeah, they didn't include the platforms here. Um, So that would have been helpful to know when we're looking at the search, to know what platform they're in. Of course, as librarians, sometimes we can tell based on how they write it out, which one it was in, but it makes it more difficult for us to decide um, what was there. Okay, so it doesn't look like they did multi-database searching, or if they did, they didn't tell us. They didn't do search registries. So let's see, what do you think about their description of their Google search? So how did they do in talking about that? Yeah, so we may not know. I think that what they're trying to say when they say, oh, this search was run, I think they just took that one search and ran it through all of them. So I think they are giving us their Google Scholar search. Whether it's good or not is another story. Um, okay, so then what about their citation searching? Do you think that that was handled well? And so we don't know if they did that through Scopus or Web of Science. Um, So we don't know a lot about that. They do talk about hand searching. Um, so maybe they're calling it hand searching when they're looking at the reference list. So I'm not exactly sure. Um, but they are trying to give us some detail there. Okay. So doesn't look like they gave us anything about filters or anything like that. Yeah, we don't know what fields these are searched in. So when we look at the actual search, this is probably not copied or pasted. And that is, we know, one of the requirements for being, right, for being fully transparent in the search. So yeah, so how exactly did they do the sorting before or after? What were they counting? So we don't know that about the citations. So let's look at the search itself. So we know that it's not copy pasted. We don't know how it was translated. What are some other issues with this search that you can see? Yeah, we don't know about how they deduped anything like that. But what about like the specific search they gave us where they kind of say, we don't have any parentheses. So I did wonder about that. Um, I thought about what if I pasted this in to see how this would work. Uh, yeah, the not is interesting. Fields. Anything else? I think maybe somebody had already mentioned. But one big issue is we don't see any mesh headings here, right? And we know that Psych Info has headings. Um, yeah, I think that they're probably missing other synonyms. Yeah, so this is kind of a mess. So this is kind of what we'll sometimes see is their search report may be okay if this is everything they actually did, but the search itself is not great. So you can meet maybe one standard and not meet another standard. Um, so let's go on to another one. And like I said, I wasn't trying to pick wonderful or terrible. I was just trying to pick examples here. So here's another example. So I'll give you a few minutes to look at that. So they did note the database and platforms. So we're doing okay with that. So for the supplementary materials, their Embase and their APA Psych Info searches looked exactly the same. So I didn't bother putting it here. They do know their updates, so they did give us some dates there. NP is a field code from Ovid, and it covers many other fields. Oh, that's true. So they search multiple databases, and maybe they search them at the same time. Maybe they just marked several things, but I think that'd be kind of weird if this was also done in PubMed. So I'm not sure which search they actually gave us. It should be different. Yeah. So yeah, that is confusing. Um, I don't think it would look like this. I think you're right. No mesh terms again. And so we see this kind of as a running theme, as an issue. Even in the last article, even in the last example that we looked at, they did mention talking to a librarian. Maybe they didn't go back, and so they didn't get into the mesh headings. Yeah, that's a field code. It's for Ovid, so I'm surprised they're saying that this is from PubMed. Um, and it's kind of the generic code that searches title, abstract, and multiple fields. Um, so I don't know exactly what it stands for, but I know it searches lots of fields. It's not one that I use, so I don't have that one memorized. Multi-purpose, that sounds right. Oh, they talked to the librarian just in the hallway and they said they consulted. Yeah. Um, so yeah, so this search is not great. Um, okay, so let's try one more. So and another reason for doing this is to kind of show y'all that um, bad searches get reported and done all the time. And any of y'all could have added to these. And so I feel like sometimes where librarians get worried, like, oh, I don't know, like all the parts of the review or something like that. I think you can still contribute to their search and make it better, um, because we can see sometimes what gets done and is was not the best for that review at all. So here's a third one, and then we'll move on to another part of the review. Um, oh, I agree. There was a lot there that's showing they didn't understand what they were doing. Yes, and that's true too, Kyle. Thank you. Um, so here's another abstract. I didn't even realize I selected two abstracts that talked about talking to their librarian. So here's another one where they say they talk to their librarian. Um, what do y'all think about this? Yes, I totally agree. The librarian should write, they should have had the librarian write this. Um, they tell us all these wonderful things that they did, but then they don't show us that, right? Because you're supposed to copy and paste the actual search. Yeah, it is weird that they say they search both PubMed and Ovid Medline. I wouldn't do that. Um, yeah, we don't know what mesh headings they used. Yeah, it could have been trimmed down. So, a lot of the medical journals, the requirement is 5,000 words or less. And so I feel like the search is one area that usually suffers a lot from being trimmed down and shortened. And we know a lot of the searches are put into the supplements and other areas, and people don't always go and look for those. Um, yeah, but uh, what gray literature did they search for? Uh, if any? And what computer assisted search protocols? I feel like that was um, interesting. So this one didn't have a supplemental that I could see. Um, but if I have unfairly said that, uh, sorry about that. But I don't remember seeing one for this one. Um, so hopefully from these different examples, you start to see um, like things that they were meeting, things that they were not meeting, things you can improve on. One thing that I like to do with my clients when we first meet, so for that total records should be in the results section. You shouldn't put those into the methods part. Um, so that's a part of that you don't see in here described well. So I'm sorry about that. But hopefully you can see like the variations. Oh, Sarah, I wish it was easy to find a good example. Maybe in our last session I can show some kind of exemplary examples. The one I have now, it meets previous Prisma requirements, but I don't know that it would meet the current Prisma requirements. I've been trying to find one that matches it better. What I may need to do is just show y'all examples from the elaboration document where they have like purposely written examples in there. So I'm sorry about that I don't have that for you today. Okay, so let's see. Oh, um, so I just have a few more slides in here to talk about some other sections. So a little bit about the Prisma flowchart. So one thing is that the Prisma flowchart was really updated a lot in Prisma 2020 with a whole other kind of section of it, which I'll show you in a second. You'll still see many reviews published using kind of the old template. And one thing to know is that even in the Prisma document, they'll say, oh, this is just an example. It's the information that's most important. And like one thing that I'll see sometimes added to the template is people want to give reasons why things were kicked out in the title abstract screening, even though Prisma doesn't ask for that. So a lot of times people will use the review software that they're in to help them with that. Some issues come up when they screened stuff that wasn't added into their software like Covidence or something like that. For example, if they were doing some gray literature searching and there wasn't like an RAS available to download, then those are things that'll have to be written in a different way. So once you download, then you edit. There's also this Prisma flowchart generator. This gives you the flowchart in different forms. So I remember one time we were submitting to an engineering journal and it required that SVG. And I was like, oh, I don't even know what that means. And so I use this generator to do that. And so it has where you can go and put the information in. And then you can also, if you're an R software person, it also has some code that you can use for that. So this is just to kind of show those different styles of doing Prisma flowcharts. And so the one that's on the right, this is more in following with the newest update to the flowchart. And you can see where it's got like, okay, databases and registers. So that's basically like anything where you're running your main searches in. And then you've got all those additional kinds of things. So it's got citation searching, hand searching. So you might add other things in there. And then the one that's on the left-hand side, I was just showing like a different example where they're kind of still using, I call it the old school style, right, of the flow chart. And it's still acceptable. They still have the information in there that that they're looking for. So hopefully that helps in thinking about like how the flow charts are. But a lot of times, like I said, I depend on like Covenants to give my group the main Prisma flow chart, and that one is based still on the old Prisma flow chart. And then any additional searching that we did, we may have to add a box or some data in there, depending if we have a RAS file for that uploaded. So we just have a few more minutes here. So I just want to cover this very last part that you might be asked to write of the paper. And this is the limitations part. This is usually just one or two sentences. And this is where you're answering the question of, did the search find all the eligible studies? So were there resources you wish you could have searched but you didn't have access to? Were there certain limiters to put on? So a lot of times the course groups we work with want to limit to English, things like that. Now, publication bias can be measured in a funnel plot, but this is only done if you do a meta-analysis. Otherwise, it's just not, it's done qualitatively, right? We have to talk about it. So in the Prisma elaboration document, this section comes up in 23C. I can't remember how many items it has on there, but 23C is the one where it talks about it. And so here I just kind of pasted in their wording from there. It could also be that there were some study reports that you couldn't access. So I know this has happened on a few reviews I've worked on where we exhausted all of our interlibrary loan options and we just could not retrieve those reports. So this is your chance to kind of write that up. So let's look at what those might look like. Oh, Kyle, if you're still here, can you put in the chat what WEIRD stood for? I know you looked that up for me. So some people might have a question about that. Sorry to put you on the spot there. I think it's like Western Europe, industrialized something. I don't think it really matters for the example, but you might be curious. I didn't know what it meant. Um, so how do you feel the first example did in expressing, oh, thank you, Kyle. How do you think the first example did in expressing the potential limits? Yeah, I would say that's a huge limiter. Before you got to that part, how did you think they were doing? I agree. I am wondering about this journal. This journal came up a lot when I was looking for systematic reviews in PubMed Central. Um, seems like might have some issues, but yes, this is not the first time I've read a systematic review that said they limited to free full text. I read another one in the epidemiology journal and it got like the editor's choice award or something like that. And I was kind of shocked about that. Um, but yeah, oh, I see. Thank you for that. What do you think about the second one? Yeah, I agree on the weird part. Yeah, that happens sometimes. So um, I feel like I kind of negotiate with the team sometimes um, about, okay, we need to have something in here about this limiter and what it might do. Um, and so I feel like, it's just going to be a couple sentences in there. Oh, that's interesting about was bought by Springer. Um, but anyways, I thought I thought this was an interesting way of um, of talking about limiting to English and what it could do. And so this is a known publication bias. It's been out there for a long time. And so I thought this one was interesting. So hopefully you did too. Okay, so I think that should be the last slide. Um, so let's see in this last few minutes here, your questions. Um, so anyone has experience evaluating, extracting, if they're willing to share. I have done this many times, evaluating and extracting. Um, and so I've done it with my own reviews. I've been part of teams that are doing it. Um, and so, of course, I would never do this like on a clinical review where I did not feel comfortable understanding what they were trying to do. But there's been other reviews more like education related or other ones where, or I focused on my own topics that I'm looking at. And so I've done this a lot. I've done it through Covidence. I've done it through Qualtrics. I've used lots of other different tools for that. How descriptive should that? Okay, so Megan's question is about how descriptive should the methods be versus putting the full detailed strategy. So you are supposed to put in the full detailed strategy. It should be pasted somewhere, whether it's in the supplement or the table. I don't agree with trying to fit it into the narrative in that way. I don't think that it works. What I would rather see in the description is more about processes and things like that. And the other thing is, what concepts did you include? And by that, I mean like, okay, we said we included infants and calcium and uh, I don't know, randomized control trials or something like that. So it's more about the big concepts in the narrative, and then you, as the reader, you would go and look at the table or the supplement to see the full description of the search and decide for yourself, was that enough? I wish that every journal, every systematic review would include at least one of the searches in the main articles somewhere. so that you didn't have to jump through all these hoops to then evaluate the quality of the methods. And we know that the search is really important in making sure that, did they find everything? Did they search all the fields? Did they search all the synonyms? That kind of thing. So hopefully that helps with your question. Thank you for that. So let's see. Oh, I'm so sorry. I did not realize we went over time. So thank you all for joining us today. And sorry I kept you a few minutes over. And thank you for joining us. I hope this was useful and you got some things to reference back.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.